Jharkhand perhaps is the only state in India which does not have a sewage treatment plant, at a time when the world is moving ahead with the mission of total sanitation and hygienic environment under the Millennium Development Goal. In Jharkhand, the entire population does not have access to safe drinking water and sanitation. Rural sanitation coverage is very low. About 30% of habitations have partial facility with drinking water. All habitations do not have safe drinking water as source contains fluoride, arsenic and iron. 1.5 kilometers from XISS is Makchund Toli, the area of our urban field work. There are approximately 1,500 households in the area. Talking about the water facility in our slum area, it has approximate 6 wells, 3 ponds, 8 tube wells and 6 hand pumps. But all these sources are impure and not fit for drinking. There is lack of municipal supply of water in most of the houses in the locality. Only 2.3% of the households have access to municipal supply of water. Only 0.7% of total population have access to drinking water facility. Though the water table of the area is sufficiently high, but it is also severely contaminated. There is no centralized sewage system in the area. Interconnection between household sewer lines and natural drains lead to indiscriminate flow of untreated waste into groundwater and open surface. The whole area does not have a proper drainage mechanism. All the people living in the area have their house drainage mouthed on the road, which gets collected in nearby places, leading to formation of swamps. Even people are reluctant enough to accept their fault. As a result, all the dirty water of houses finally gets collected on the road, providing a quasi-reservoir for the birth of pathogens. Of contaminated water. They still consume the same water for the purpose of drinking and washing their clothes and utensils. Even the same bacterial water is used in the kitchens for washing of vegetables. Of every well inspected, none of the wells had a proper drainage around it for disposal of collected water. As a result, the dirty water was again collected nearby wells, serving as homes to some of the most infectious bacteria, viruses, flies and mosquitoes. At some places we found that the used water after washing of utensils or vegetables drained back into the well. At some places we were staggered to see that the municipal supply water pipes were broken and large amount of water leakage was taking place. This water got collected on the roads as there is no proper channels of drainage. During the primary survey that was conducted, it was found that 4 children were suffering from jaundice and 3 children were suffering from diarrhea. Every week we found that one or the other child who came to Belwadi was sick. On inquiring regarding illness, we came across various facts that was responsible for their current health status. For example, lack of proper sanitation, improper diet, unfit and impure drinking water, lack of medical facilities and behavioral negligence among the slum dwellers. Also, we came to know that government hospital like Sadar Hospital did not provide medicines at subsidized rates. Disposal of garbage is also one of the major concerns of the area. Every land that is left barren becomes the disposal spot for the entire area. Not only disposal of garbage takes place, but the sewage water is also directed towards the barren land. We also got an opportunity to visit the Sarva Shiksha Abhiyan school so that we could look into the sanitary condition that were being provided to kids. On request we were allowed to enter into the toilet of the school, which was kept locked, which was a matter of surprise. We were astonished as the toilet did not have electricity. Even the drinking water system seemed to have not been used since long duration of time. The toilet had a single urinal with no proper water facility provided. After crossing the toilet we found the kitchen, which was very neat and clean. The kitchen had a municipal tap water supply. After coming out of the school we saw beautiful posters on school walls regarding drinking of clean water, cleanliness and washing of hands. But to our surprise we found that the land just around the posters were dirty and surrounded by garbage. Even the school did not have a proper drainage system. The kids mostly did not use the toilet. The slum also has good number of boys' lodges. So we decided to have a look at the cleanliness of the lodges being maintained. And the situation was really devastating. Chhat Puja was nearing by when we were performing the surveys. So we decided to look at the cleanliness of the ponds. We came to know that our MC was not at all into cleaning of the pond, rather some local people took the initiative to clean the pond. Though previously the pond was being used for washing of clothes by the people of slum, but the condition was really unfavorable. And to utter surprise people still performed the puja in that dirty pond.